This class is about complete denture patient examination, diagnosis, treatment planning. These are the contents of this class. Moving on to the introduction, evaluation of patients for complete denture treatment should be thorough and well documented, and it is recommended that we meet the mind of the patient before we meet the mouth of the patient. As per GPG definition, case history is the collected data about an individual, including the family, medical, dental history, or any other information which is used for deriving a diagnosis and proper treatment plan for the patient. Diagnosis is the determination of the nature of the disease. Treatment plan is the sequence of procedures which are planned for drawing the therapeutics of the patient. Prognosis is a forecast as to obtain a probable result of the disease or a course of the therapy. Coming on to the case history, the first details that we ask are the personal details. Now, name of the patient is asked to obtain a psychological benefit to the patient and to maintain the medical legal records. Age is an indicator of the patient's ability to wear and to adapt and to identify the expectations of the patient. Gender is to identify any disease which is related to genders. For example, women are more prone to development of osteoporosis, especially postmenopausal women, and female patients could be more exacting with aesthetics than with function. Race is also considered as an important factor. Coming on to occupation, job and social standing determines the value he or she places on oral health. Certain occupations can demand huge expectations like placement of immediate dentures rather than conventional dentures, or can be an alteration in the denture making like for chefs and for orators or for public speaking people. You may have to make the dentures with roofless tops so that they are able to better appreciate the phonetics and the taste of the food. The address and contact number is used for correspondence and for maintenance of proper documentation. The chief complaint is to be always recorded in the patient's own words, and it is important to draw what is the expectations of the patient, because most expectations could be unrealistic and unattainable, and this has to be identified in the first clinical appointment. Apart from that, we have a vast array of medical histories which has to be inquired from the patients, because this could be having a significant correlation during the fabrication of complete dentures. According to the Mental's attitude classification given by House, he classified class 1, class 2, class 3, class 4 patients. Philosophical patients are very cooperative and understanding patients. They are able to understand the treatment process. Their prognosis is good, and exacting patients are critical patients who are continuously questioning the operator regarding the procedures which are done, and the doctor has to be really patient enough to handle such individuals. Class 3 patients are hysterical or antagonistic patients, could be having some underlying problems which has to be attended. On the other hand, we have class 4 patients who are indifferent or passive patients, who are exactly opposite to philosophical patients. They have worse prognosis, they are not interested in treatment, they have come because of compulsion of the family. So this is a picture which clearly shows the various classes of mental attitude given by House. Coming on to nutritional status, it is important to understand whether the patient is well nourished or moderately nourished or malnourished. We need to identify the patients whether they are having any parafunctional habits like bruxism, smoking, or pan chewing, because there could be existence of any pre-malignant lesions, or there can be stains which can be smoker's palate, or stains which has to be the patient could be having. The dental history, it is important to do an examination of the intraoral and an extraoral examination. You need to find out what was the reason of the loss of teeth, and since how long the patient has been edentulous, because if the patient has reported immediately after the loss of the last teeth, it shows that the patient is interested in treatment. Instead, if the patient has been a chronic edentulous period, it shows that the patient is either not interested at all, and there can be also more amount of ridge resorption. If the patient is a previous denture wearer, these factors should be detailedly examined, and the reason for the patient coming for a new set of dentures has to be evaluated and identified. Coming on to clinical examination, we have extraoral and intraoral examination, radiographic examination, examination of pre-extraction records, so that the prognosis can be studied, a proper treatment plan can be drawn. In extraoral examination, we need to identify the build of the patient and then the gait of the patient. By knowing the gait of the patient, we understand the associated joint problems or bone problems which could also affect the temporomandibular joint. Facial analysis, the first thing that has to be analyzed is facial profile, because this helps in detecting the amount of loss of lower 1/3 of the face, also helps to determine the jaw relation between the maxilla and mandible, whether it is straight or convex or concave. Even patients who have been chronic edentulous, the relationship becomes a class 3. The facial form, which was given, classification was given by Williams. It's called Williams classification of facial form. You have square, you have square tapering, tapering and ovoid. This exactly determines the this is helpful in determining the selection of artificial anterior teeth. Facial symmetry, and you need to find out if there is existence of any cross asymmetries, because it could be because of some stroke or paralysis or Bell's palsy, because this can have a significant effect on the outlook of the patient because of midline shift or the selection of teeth. Complexion or skin color is useful for selection of the teeth color. The muscle tone, whether it is class 1, class 2 or class 3, to identify the loss of vertical dimension. Class 3 is greatly impaired muscle tone. Lip support, because lip is something which is important for supporting the maxillary arch and the teeth. We need to find out whether there